Hello and welcome everyone to a live stream intergenerational and inspirational conversation about improving health equity for older adults through digital literacy and AI. I'm your host, Ande Lyons, producer and host of the Don't Be Caged by Your Age podcast, where every week I'm chatting with folks who have shattered age related expectations and stereotypes while providing resources, inspiration, and ideas to help you stay tuned in and turned on to life as you age. And I love providing representation of folks thriving after 65. That's why I only interview folks over 60 on the podcast, because if you see it, you can be it, right? But as many of you know from prior episodes on the podcast, I'm always chatting about how important it is to have intergenerational relationships. So I thought, why not interview one of my favorites, the 25-year-old founder of Carevocacy, a company dedicated to empowering older adults with digital literacy skills that enhance their access to healthcare while bridging generational and technological divides. So please join me in welcoming the Fab founder and oh so sensational Stefano Selorio. Woo! Get the clappers out, everyone. This is a live stream show. How are you, Stefano?
Hi, Andy. How are you? I'm doing well. Thank you so much for having me.
Oh, I'm
Happy to
so,
be here.
so, I'm so delighted that you're here to share your stories and backgrounds and all the good things, and also the impactful services your company, Carevocacy, provides to older adults. So I'm so thrilled. How are you doing?
I'm doing good. It is a Tuesday afternoon. I'm excited to share some of the work that we do, and most importantly, I'm excited to be here because as I've shared with you before the show started, I've been a huge fan of yours, and so when you asked me to be on here, I was one nervous, but also excited, and again, so grateful to be here,
Oh,
especially with the amazing guests that you've brought up in the past episode. So thank you
oh,
so much.
thank you, Stefano. And listeners, as you know, I always ask everyone, how many years have you been living and where are you hailing from? So go ahead, Stefano, fill us in.
So, as you said in the beginning, I'm not your typical guest. I am 25 years old, and my company and team is based out of Miami, Florida. So
Oh,
we're here saying hello from the Sunshine State.
yay. And folks, today, Stefano and I are exploring the essential role of technology in healthcare, making health resources accessible to all, regardless of age, background, or tech familiarity. And as I said earlier, Stefano's company, Carevocacy, is dedicated to empowering older adults with digital literacy skills that enhance their access to healthcare while bridging generational and technological divides. And Stefano's work is really, truly transforming lives, promoting tech skills for better health outcomes and building a foundation for lifelong learning and inclusion, which I just love something fierce. I just can get those clappers out again. It's so important. So, Stefano, I mean, you're 25 years old. When did you launch Carevocacy? And actually, what compelled you to provide digital literacy skills to older adults? I'm so curious.
Yeah, thank you so much for that question. And I love that. I love answering that question because it kind of brings me back to where it all began. And it really starts with one of my current roles today is not only being a CEO, but it's also being a caregiver to my grandma who's living with Alzheimer's. And when I was a freshman in college, about a few years ago, obviously, um, my family and I decided to bring in my grandma from the Philippines and have her stay with us, and we became her primary caregivers. And that obviously shifted so many expectations and career changes and things like that. And so one of the people that got affected obviously were me, and I was trying to study marketing during school. And I had to make a decision to switch schools to be a little bit closer to home, to be able to be available for grandma. And eventually, I started to really look into technology startups and companies for older adults and the aging space, specifically for caregivers, which, by the way, caregivers, one of the biggest things that we all want is our time back sometimes. And so I was really trying to figure out what could I contribute to that. And
Yes.
then I started to look into just the bigger scope of the market itself. I actually started to look into the industry more so in 2019, or end of 2019, and then started to really launch the business in 2020. And I
God, you
remember
were
it
a
was just
baby.
me. I was just me. I know it was just me. I would go from home to home on January 2020, by the way. So just that's a specific date because I would go from home to home tutoring folks on how to use their iPads. And then eventually, something happened in 3 months later during that
That's
year.
right.
And it was a huge learning lesson from the pivot. And fast forward to now, it's grown to something that I never thought could be, but ultimately it's helping folks with digital literacy and meeting
Yeah.
people where they're at when it comes to
Yeah.
bridging the digital divide. And these opportunities these past few years has been really uh, really great just because I've been able to work with so many folks with different variety levels of digital literacy, and it's just been amazing to kind of be working in the space so far.
And you hit on something that was so important. And I just love that at the age of, at the time, 4 years ago, you were 21. And I know everyone, I practiced some reverse ageism there. I'm aware. But that you were compelled to go into this category, this health equity category, because you knew from taking care of your grandmother that she needed to, if you wanted to find anything out about her health, you had to go online, you had to log in, you had to figure out. A
Mm.
lot of the test results are coming back to us now through technology. We're not getting the phone calls unless it's super serious, and all of that. But also inside you, you had the compassion to
Mm.
understand that, oh, this is, I need to help this target audience out. What happened that you felt that need to go and serve this industry in that way? And what is it about you, inside of you, right? The personal experiences or challenges that led you to focus on this group of older adults and on digital literacy?
Yeah, I would also kind of go back to that first question, which was really when I was trying to figure out what career, especially as a
Right.
college student, I wasn't able to really find one that would accommodate to my lifestyle as a caregiver. And so, really trying to understand where I would gonna fit in after I graduate was something I was trying to figure out at the time. And I thought entrepreneurship was definitely the avenue for me to explore, not only be a caregiver at the same time, but then also to have some sort of opportunity to be stable. And so I was really leaning into entrepreneurship. At the time, I didn't know it was going to be in the aging or age tech industry, but I really wanted to combine something that I was passionate about, which was really helping people. And I think that at the same time was great timing to be able to be the opportunity to be a caregiver at the same time. Specifically around health equity, I think ultimately the connection between someone who has low digital literacy level can correlate to someone who has low access to healthcare. And what I mean by that is there's a term in the healthcare system called the social determinants of health, which is
Wait a minute, say that
basically
again.
the social determinants of health. So yeah, it's a big bunch of words, but in an easy definition, it basically means that there are certain categories in our life that determine whether we're healthy. And one of these categories could be access to healthcare, education, economic opportunities, social connection. And so if one of those areas are affected by some sort of lack of access or literacy, um, most cases that person could be more healthier or isn't healthier or just doesn't have access to those things. And when you start to
Wow.
think about where technology is heading, a majority of how to have access to those things require a form of digital literacy. So, for example, you and I were able to connect via podcasts and LinkedIn and all those amazing social media platforms. But imagine the potential that we could unlock for folks who don't know that they could have that kind of social connection. And if
Right.
we could provide that some sort of tech education and digital literacy to them, or even if we're talking about healthcare, we know that, as you mentioned before, a lot of health systems right now are transforming into more of a telehealth approach. And
Right.
so if the person can't physically go to their clinic and they're forced to do telehealth, but they don't know how to do that, we're limiting the access for someone to have healthcare needs that are being met through the physician. And
E-
so
Even the vocabulary, tele what? Right? Telehealth.
telehealth, yes, I know. When I first started that, I was like, I need to do some research.
Oh my God.
But
I'm going to say,
I think it's just making it a bigger
yeah.
deal, right? Like digital literacy should be something for everybody.
Absolutely. And I love that you're helping this category. I just want to say a quick hi to my pal, Mia Voss, here for this fabulous interview. Really, of course, Stefano, it was so much fun, Mia. And I know Mia has aging parents as well and has
Mm,
helped them a lot with their technology because you're right. If the rest of the world is online, you feel even more isolated as you age by not being up with the literacy of how to do that. And that's not to disparage the age group, excuse me, of the baby boomers and older Gen X's, where, we've had tech companies since the 70s. We've been coding since the 70s, but there still
yes.
has been some real mental blocks against that. Where, again, this show, Don't Be Caged by Your Age, Stefano, is all about dissolving those internalized beliefs where we've been indoctrinated to think, well, we can't do that, right? And that's too difficult to understand. And so I love that you're reaching out to this community of older adults and helping them understand that they have the brain power, they have the skill set that they can do it. So when and folks, can I just do a quick shout out for Stefano? I may get the Morocco out for this. Morocco's out for this. He has earned the 30 under 30 Forbes list. He's made it there. So, again, that's a big deal to make it on that list. I'm so proud of you. That is not easy. You had to figure out a lot of things to make it on that list. So, a quick shout out for that. But can you share some specific ways this digital literacy, these digital literacy skills, including understanding AI, artificial intelligence, can directly impact health equity for adults? Because telehealth, that's something new. But now we get into some murky waters for people. And I'm
Yeah.
sure folks are getting frightened by artificial intelligence, AI, and how that works. Walk us through how you start working with someone and upping their game, upping their skill set. And do you do it
Yeah.
in groups? Do you do it on one? Let's talk a little bit about that.
Yeah, well, when we first started, as I mentioned before, it was just me working with folks individually and helping them out and be a one-on-one tech tutor. And then eventually, as the pandemic died down here, we explored an opportunity actually to be contracted out and provide tech classes across the Miami area. As you probably see in those photos, some of the fun classes that we were being part of, we actually were able to partner up with a major Medicare health plan called Humana. We were able to provide tech classes across 19 locations across Miami, serving about 23,000 Medicare Advantage patients. And again, these were patients who were going through our tech classes, receiving education about not only basic technology like texting and emails and things like that, but they were interacting with our tech tutors, or I would like to call them as carevocates. Again, it's a combination of care and advocacy, but these were folks who were curious about technology, who were obviously accessing healthcare in different ways. And so we came in and really provided an experience. But as you mentioned before, and before the pre-live, we love to entertain too, as well too, Andy. So that's what we did. We were able to transform certain topics that were typically difficult for folks who have low digital literacy level and make it really fun and engaging. We had an amazing team who were really one who met people where they're at, because we had a variety of different cultures that we were serving in Miami. But ultimately, we were trying to make sure that they were connected with the technology that they were being asked to use, especially when it comes to healthcare. So, for
Right.
example, one of our lessons and topics and campaigns we were working on was to really coordinate around encouraging patients to use SMS to receive text reminders when it came to appointment reminders, or when it came to reminders for when their transportation was around the corner. Other things that we helped them work with was
So, like
to
how to
make.
get Uber to pick you up and drop you off?
Yes. Yeah.
I mean, that's my next question, because, how many folks who are tuning in have had a question about how does this work on my phone? And of course, you could go down to a facility like an iPhone store, Apple store, or
Yes,
someplace,
a
but you often
Genius
get
Bar or
yeah, genius,
yeah.
but you often get treated terribly, like eye rolling, and they talk too fast, and all the things, and they move too quickly. There's just some quick questions you might have about your phone, right? That you were hoping someone would explain to you.
Mm.
And I
I think
see that's where you come in too.
yeah, I think so our perspective has always been that whenever we have a learner come and ask us a question, it's not out of fear, but it's more out of curiosity. And I think that different framing really makes a difference when it comes to interacting with the learners that we've been able to impact. And so as I've trained my team, these are folks who are trying to reinvest in themselves. These are not folks who are trying to feel like they're being scolded by technology, that they're really curious and they want to advance themselves. And we see that all the time. And I think, for all my fellow digital literacy navigators out there, I am sure we all have that same passion about how we approach folks who are trying to learn about technology.
Right.
And so, in the same way that we're doing that with artificial intelligence today, which is not an easy topic to talk about, but having
No.
done some of these classes myself and also been able to provide some sort of solutions for them, a lot of folks are really excited about the use of AI, and I'm actually really excited about that because it's something that you thought that from a headlines perspective you never would put those things together, but in reality, when you really bring it to people who are just curious about technology, they accept it, they adopt it, and they're really ready to learn more about it.
How do you talk about AI with older adults? Because do you teach them how to go on ChatGPT? Do you teach them how to create bobbleheads? Like, do you get into the creative end of it? Like, how does it even come up in a discussion?
So I'll speak from how I teach about artificial intelligence. I'm
Hmm.
sure some of our other tech tutors do it differently, but usually what happens is I approach it from a historical perspective, right? From let's start with where we began. By for example, we normally exchange information from either each other, right? Human intelligence, from usually the information that we know mixed in with a lot of bias and other things that come into play. But that's how normally we exchange information. And then as time grew, we either did it from books, from libraries, from encyclopedias, whatever. It was from some sort of resource beyond ourselves, right?
Right.
And then eventually we got into the computer age where we really got to use technology like computers to really research things and look up information. And
Yeah.
now we're in this age of technology where yes, a majority of the information before this was more so human created and researched by humans, but now we have information that's even created by computers. And so I kind of go through that as a breakdown of where we are and where we were back then and where we are now, so that way they have a better understanding of the timeline of the history of information, and it doesn't feel as scary, the transition from
Right.
human intelligence to artificial intelligence, because in reality it's just a progression of technology, right? We
Right.
don't say that we don't want the wheel to the original wheel, right? We want the
Right.
wheel of tomorrow. And so I think breaking it down like that makes it easier for folks to digest what artificial intelligence is.
Right. And also the way artificial intelligence really can, like, basically go through a brain, so to speak, of combination of things that you've
Yes.
learned throughout your life and pull out what you need. Wouldn't that be handy on a daily basis for us older folks?
But what the crazy thing about our AI right now is that it's still, again, human influenced, right? Human trained. And so
And that's
regardless
why,
of yeah.
yeah, and that's why,
Go ahead.
and for certain communities, they're still not hearing their voice. So our Black
Mm,
community is kind of like, look, you got to up your game, AI, because I'm hearing some white voices there for sure, but I'm not hearing my community voice as much. It's getting much, much better.
Of
But yeah,
course.
I chose that community, but it's other communities as well that it may not be picking up on. You know who well, first of all, I just want to remind everybody we're chatting with Stefano Selorio, founder and CEO of Carevocacy. Please visit carevocacy.com, carevocacy.com, to learn more about this remarkable and impactful organization. You know, a while back, I interviewed the wonderful Raymond Jetson from Aging While Black, and this is one of his pillars right here, which is embrace rapid change and innovation and new technologies and systems. So we need to put you in touch with him, Stefano, because this is a real important part of his platform, right? Is helping the older Black adults have a better understanding of innovation and technology, because you're not only teaching this population on how to have better grasp of using technology, but you're sparking innovation. There's no doubt in my mind that those fertile brains are getting planted with some amazing ideas that they may want to go off and run with, right? And do themselves.
Yeah, I would say we work with, as I mentioned before, we work with a variety of learners with
Right.
diverse backgrounds, diverse cultures. We worked with the Latin population as well as the Haitian Creole population. Even as an Asian American, as a Filipino American, it would just be wrong to not create some sort of opportunity for all types of learners. And so
That's right.
that's one of our focuses for sure. And you had mentioned some of the unlocking potential. We had one learner who is 90 years old and who had survived the Holocaust learn how to use TikTok as his platform to share the music that he has created. And so those are just some of the uh, Kervoxy stories that I love to share because, if it honestly, it wasn't even we were the one inputting that curiosity in them. They were asking us to be, well, I am creating this music. I want to share it to the world. How do I do that? And so we said we
Oh my
went through a
gosh.
variety of options for them to go through. And interestingly enough, TikTok and Facebook Live was their opportunity to showcase the music that they were working on. And so those are just some of the amazing stuff that we get to see with the work that we do. And ultimately, I hope that the work that we do in the long term helps them to be much more healthier just because they have better access to digital literacy.
Exactly. And, you know, what you're also doing at the same time, I imagine, is dissolving some of the limitations and blocks, mindset blocks that they may have about using the technology. So, first, you've got the curious ones who want to share their music on TikTok. Just show me how to do it, Stefano, right? But then you've got other people who might be looking over there thinking, gee, that would be a nice idea, but I don't know if I can do it. You know, what are some of the biggest challenges that you're seeing with this age group? Even from, I need to get to the doctor's office, I need to call an Uber. What are some of the challenges that you're seeing that you're able to
Hmm.
dissolve?
I hope this is not much of a hot take, but older adults and people are not any different.
There we go.
and
That's what we wanted to hear.
older adults and young people or middle-aged people are basically the same types of people. We just have different journeys, similar journeys. I don't think there's a major difference. And the reason why I say that is because, as I mentioned before, I was a college student. I was trying to figure out what I want to do in life. I wanted to reinvest in myself. I think that's the same thing in application to the learners that we work with,
Right.
right? They've done things what they typically would have done in the past, but they want to do something new. They want to learn. They want to try out things. And
Beautiful.
so I think we connect at a very deeper level of just curious minds. The best people that we work with is not necessarily based on demographics, but psychographics. So, do they have the curiosity to engage in new things? And that's really the best type of learners that we work with. And then you had mentioned, some of the challenges that we face. Unfortunately, um, the hardest part of the work that we do isn't actually giving that information, that technology education to them, or even providing the classes. That's not really the hard part. The hard part is really the therapeutic aspects of having somebody guide you, sit you down, and really be patient with you, or whether you use our group classes, our private tutors, or the AI tool that we have. It's really making sure that that person feels comfortable and empowered to feel that they can have access to this type of education and technology. And so most of the time, a lot of our learners, bring themselves down. And so our jobs as care advocates, we have to end up really propping them up so many times. And I say this, I'm laughing because it's so unfortunate, but it's so true for a
Yeah.
lot of the population that we work with. And so I think our work sometimes gets underestimated because it's not about a quick fix on tech support. It's about really making sure the person feels like they have the confidence to
The
do this again.
confidence.
So
And
that's really what we do.
I agree, Mia Voss. That was a wonderful hot take. It really helps dissolve ageism when you put it into those terms that working with older adults is no different than working with any segment of the population,
Yeah.
right? Oh, that's so good. And in all of this too reminds me of a conversation I had with Deborah Greenhut. I think it's episode 18, folks, where she talked about how to survive being a caregiver. And you mentioned early on, Stefano, how this also helps the caregiver. It helps give
Mm.
them back more time because it's so important when you're taking care of a beloved that you don't get burned out. And there are technology resources as well as services throughout the communities that can help you, the caregiver. Can you talk a little bit about that? Because I love the word care.
Care
Now,
advocates.
care of kids. I don't know if I'm ever going to be able to say that, but I love
Hey,
it.
I had 5 years of practice to say it, so I've had to I've had to make sure that people can hear it. So,
Oh my
yeah,
gosh.
no, funny enough, when I was coming up with that name, the word advocacy was so prevalent amongst caregivers
Yeah,
that we need someone else to not only advocate for the work that we do, but to advocate for us, for who we are. Because what
right,
happens sometimes as caregivers, we're left in the background for sure when it comes to some of these decisions. And so, when I saw that word advocacy and care, I was like, let me just make a company name that would really be hard to pronounce, but really hit home to a lot of folks who understand that this experience as caregivers, which is really
right.
providing that advocacy. And so I think that the work that we do does buy folks a lot more time than usually that they would normally have. I know that majority of our clients ends up happening being the adult children of some of these learners that are asking for help that they can't help mom or dad sometimes
Right.
because of either they don't live in the same state or they just don't have the bandwidth or the time to provide that type of service. And you put up you put up Oppo AI, and we get to do that actually with some of our new technology that we've been invested into. We talked about AI in the previous back, but we created Oppo AI as a way to provide mom and dad or any learner someone they can text their tech questions to without the fear of judgment. 24/7 available without downloading an application, and it's done through SMS, through texting, which is the app that you already have on your phone.
Right. So
So yeah,
let's describe this for our listeners. So listeners, I have a slide up and you can hop on YouTube to watch this anytime. And go ahead and walk us through because it shows a cell phone and then it shows this wonderful little creature. Talk about it.
yeah. So I don't know if your audience are familiar, but we wanted to be the Duolingo for lifelong learners who wanted to learn more about tech education, right? So on a Duolingo app where you learn languages, on our program you get to learn more about technology. And as you see on the screen here, we actually created a little fun mascot. It is the Filipino tarsier wearing a purple cashmere sweater, and I thought it was very fitting because it just evokes curiosity and uncomfortably. And so we called it Apo AI, and Apo again is the Filipino word for grandchild. And fun fact, it was actually the word that my grandma would call me over because she didn't remember my name, obviously due to the Alzheimer's. And so she would call me over and she'd say, Apo, Apo, come over here, grandchild, come over here. And so, when we started to build this technology, this AI, when I was deciding what to name it, I said, you know what? We at some point in our lives become grandchildren, right? And so
Right.
we get to become that helpful hand for folks. And so, yeah, we developed Apple AI focused on really helping individuals have better access to digital literacy, digital health literacy, and in a way that isn't so invasive, right? It isn't asking of them to do so much except for texting a question to our phone number. And
Right.
going back to caregivers buying their time, we have adult children now who are offering this to their parents lovingly as an alternative because sometimes they may not get their answers. I'm sorry, their questions answered quickly from their loved ones. So that's where Apple AI can come in and
Right.
help them.
And listen, so when you look at the screen, you're seeing someone saying, "Hi there, I'm Appo, a helpful bot created by Carevocacy to provide tech support for the elderly." We like to say older adults in the pro-aging movement. I'm here to help you with any tech-related issues you may have. Please let me know how I can be of assistance. And so the question here is, how do I take a picture on my iPhone? And then it responds, sure, taking a picture on your iPhone is easy. Here are the steps. One, find the camera. So it instead of having your older adult calling you and saying, "Now, how do I do this again? Mom, ask Appo." Or dad, ask Appo, or grandma, or auntie.
Yeah, I think it goes back to we're not here to replace the human connection and
Right.
touch. I think it's ultimately how do we scale the work of health equity and digital literacy, and AI has given us that opportunity, not only us, and I'm sure other companies and other people, to have access to resources they can have they can reach out to when sometimes our human counterparts aren't available sometimes,
Right.
right?
Right.
And
Or you
I
don't
think
want to
it's
bother
helpful.
them. You want to,
Yeah.
I want to figure this out
First of all,
myself.
it's
And
not a bothersome to ask a question about technology, okay? I'm just saying that to anyone who feels like they're bothering a loved one. I think that's ridiculous.
okay,
I
Stefano,
think
I love that.
it No, that's what look, I feel like that's where it begins, right? Where we feel like we're
Oh,
intruding on someone, and that's where we start to limit ourselves from
isolate.
asking questions, right?
Yeah,
Because we think we're going to bother someone, but no, this is an opportunity, especially with our tool. But if you ever ask somebody for help, I don't think it should be an issue. But that's
that's
just
right.
me.
And
Yeah.
I love me comment, which is your mascot is adorbs, and I love the story behind it. Appo, come get this for me, Appo. Um, it's just great that you've built this technology and pulled it together and figured out so many of the components. It's important. I don't care how old you are as an entrepreneur, you have to you're solving a problem people want you to solve and are willing to have you pay them to solve it. And you figured that out. You found
Uh,
the
yeah, I
the
was just
company.
going to mention, Andy, if you don't mind,
Yeah.
this not only was this something that we saw a lot of our caregivers requesting, but what happened between our classes was we would teach a class on technology or other some topic or on online safety, and then we would do the class a week later. But then we didn't have anything in between to retain the information for our learners.
Right.
And so they didn't have anybody they can reach out to. They couldn't physically go to the center all the time, and we weren't there physically all the time. And so we thought that the best way to help with retention and engage with folks outside of the classroom was to provide Apple AI as a tool to do
Right.
that. And so
Right.
those are just some of the solutions that if it weren't for working with lifelong learners and older adults, I don't think we would have been able to create this thing. And it's so important to design it for the people that we're trying to serve. So I
Well,
appreciate you saying that.
as we say here in Boston, that's wicked smart of you to have done that. No, seriously, because now and also it increases curiosity and makes technology even more user friendly when you can ask Appo any question you want. I mean, look, I don't know about you, but I rely on Alexa for a lot of things. For the same reason, but now this is specific and on the phone. So let's talk a little bit about the intergenerational experience. I have been blessed to have a lot of wonderful people in my life that are 40. I'm 68, everyone. I think I may have forgotten to say that at the beginning of the show that I'm 68 and Stefano is 25. So, especially when I was in the startup ecosystem, I easily had folks who were over 40 years younger than me. And it's so wonderful to have that experience. What has surprised you the most, Stefano, about working with older adults?
Yeah, I would say I come from a background where we always respected our elders, right? And I don't mean that in a condescending way when we say elders, but in my culture, when we
Oh,
say
yeah,
elders, they're put in this high pedestal, right? And so I
exactly. Thank
so
you
when
for
when
that
I get asked that
clarification.
question, actually, I find it really surprising when someone asks me if there's something surprising to interact with seniors because I I've been interacting with seniors and older adults and lifelong learners all my life. I
Right?
don't I don't see any I didn't see anything surprising for me. I think the only thing that was surprising to me was that we are creating technology not made for this population, for this demographic
Yeah.
enough, or we're not working with them enough to make it for them. And so I think that was the most surprising from a industry perspective, not necessarily working with older adults, but more so from working with colleagues who are designing technology to
Yeah.
organizations that do work with ageism and aging. I think that was more of a surprising thing for me. I grew up, I remember just growing up with a lot of grandparents and older adults in the house, and always being the kid that they were talking to, and I had to grow up very quickly. I was a Rotary Club member in my local city, and so I was the youngest member in that club, and that didn't bother me at all. It was more of like that was the role I always played, and we had people there who were definitely business owners up to 68, 50, 40, didn't matter.
Right.
So I would say nothing really has surprised me working with older adults. I think the only thing that has surprised me is definitely working with tech folks who are trying to build products with older
I
adults.
Yeah, age tech as we know and love it. And what has that whole intergenerational experience, because now you're working all the different generations as
Yes.
you work with product developers. And it's wonderful to be on this type of spectrum where you're not afraid to be the youngest person in the room. And as I'm always telling folks, don't be afraid to be the oldest person in the room.
That's so
And
important.
can you just tell us a story of what it's been like working with your elders, with the older adults that just made your heart get all warm and yummy?
Yeah, I'll share a funny story. We were actually in the process of onboarding folks to Apple AI. We had about 50 people signed up in one room, and the funniest thing that we received being asked about our tech tutor chatbot Apple AI, which is supposed to be just for tech tutors, is that we had a learner who asked how they could find a good man in their life. And I was like, okay, interesting. And then she followed up with, how do I get on dating apps?
Right,
And
silver singles.
I wouldn't say that was a big surprise because I think you could find love at any age, but I think it was a really good reminder
Yes.
for anyone who's building technology for lifelong learners, is that we're still human. We're still engaging in a variety of experiences. So whether you're so and so of this age, it shouldn't be much of a surprise that they're asking about finding a partner in their life at that certain age. So I think that was really interesting to see that, and to
I
also just
love
learn more
that.
about their background and learn more about them from
Right, and you
understanding
probably
that.
should partner with, because I'm listeners, I'm trying to remember what episode that was. I have to go to Don't Be Caged by Your Age to just remember which episode it was that we had the great conversation with the doctors, Dr. Gloria Horsley and Dr. Frank Powers. That's episode 26. And they wrote the book they're the authors of Open to Love, The Secrets of Senior Dating. And you're absolutely right, Stefano. Having, first of all, the technology acumen to actually get on a dating site, but also this is where you can easily find love. And they both, I think Frank was 81 and Gloria 84 or 85 when they met, and just are having a wonderful, wonderful love and marriage with each other and relationship with each other. And that's another wonderful service that you're providing. Oh, Stefano, you're so amazing. And also you volunteer or you work on the Aging Council. Talk a little bit about that.
Yeah, I think you're referring to the American Society on Aging, which
Yeah.
is a national organization that has been providing resources and education around aging work. And so the organization has been around for years. I actually got associated with them about a few years back, and I'm part of their host committee for this upcoming conference in Orlando, Florida.
Okay.
I believe the conference will be coming up in April of next year, and I'm really excited about that to one, also welcome people to the state of Florida, but then to also learn from other folks who are working in the aging space. So definitely, if you're a pro
And to
age
hug in real
aging,
life with me.
yes, oh yeah, yes, and to finally meet, of course, yes, to finally meet Andy, um, which by the way, she might have a show there. Who knows?
I would love
But
to do some live
yeah,
interviews
but
there for sure, or recorded interviews.
yeah, no,
But
I
I
would
love that
say,
you're in the space that way too. So
of
you're
course.
serving the community, at the major aging conference, which means you're getting the, aging, pro aging um, literacy as well, to help everyone remember that ambition is ageless, that we need to honor the ages that we're at and embrace and age out loud and be proud that we have lived these many many years and we deserve respect, and how to help the world do that. And you're doing it beautifully, because I can tell from the website carevocacy.com, folks, you'll go there, you'll feel the respect for older adults and how you're serving them with dignity, right? And instead of acting as if they, are 3-year-old toddlers. Sometimes that happens, folks. People start using that sing-song voice and it's not good. How can folks work with you and the Carevocacy team, especially if someone wants to say, hey, come on into our organization, we need help? How can folks find you and work with you?
Yeah, thank you so much for that question. Yeah, I would say there's a few ways that you can connect with me. If you are a LinkedIn learner like myself and Andy, you can more than welcome to connect with me on LinkedIn and we can have a conversation there. You're more than welcome to reach out to me via email as well, which is stefano@carevocacy.com. Or if you'd like to learn more about the work that we do, definitely visit carevocacy.com, or apotutor.com is where you can actually sign up for free for the Apple AI today. So there's no cost for it because we wanted to provide it for folks who just wanted to have access to a tutor for free. But if you're an organization that are looking to expand more about the digital literacy or digital health literacy work that you do, you're more than welcome to reach out to me and we can talk a little bit about how Apple AI can help your organization. But
Ah,
we're also on Instagram and Facebook. I'm on TikTok, but it's more so of like a public Google Drive of my founder's journey. But I'm more active on LinkedIn and as well as on our email.
oh.
So more than welcome to reach out to us.
Well, I am so delighted that you joined me for this intergenerational and inspirational conversation on Don't Be Caged by Your Age. And folks, you know where to find Don't Be Caged by Your Age podcast on any of the podcast platforms, Apple Podcasts, Spotify. You can ask Alexa, Alexa. She's right here because I'm afraid she's going to talk back to me. Alexa, and all the platforms, as well as YouTube, where you can see the. See, there she is. Um, uh, where you can see me and Stefano having this delicious conversation, and know that we're always waving out there. I'm so thrilled, Stefano, that we finally got to make this happen, because we've known each other for a long time. And I want to remind folks, please, especially those of my age, older, keep building those intergenerational relationships. We need the combination of the communication, as Stefano was saying. We're all humans on this journey, and all our different brains and all our different lived experiences and enthusiasms and passions come together when you're able to build that. And thank you, Mia Voss, for tuning in live with us today. She says, great info. Thank you so much, Stefano and Andy. That's the beauty of live streaming. We get to wave to our friends while we're chatting live here. But I also want to remember listeners to remember you have so much to give. And this is at any age, of course, but specifically the 60 plus crowd. Please do not let those internalized ageist beliefs prevent you from pursuing new dreams and opportunities. Keep grabbing that torch and keep it brightly lit for future generations, and keep bringing your deliciousness to the world. We need you. We really, really do. And I always saying that to myself, despite what we've been told as we've aged. So keep glowing, keep growing. Until next time, I'm wishing you a delicious day from Boston. Mwah! And Stefano, thank you.
Thank you so much.
Yay.